Hi, I'm Dr. Ian Fu, and I practice here in our Smile-Based Signature Center located in Penang, Malaysia. This is my submission for Straumann Malaysia's YPP case presentation. This is my patient, Mr. E, and he came in with a chief complaint of loose upper teeth, resulting in difficulty eating. These are some extraoral photos of Mr. E. Extraorally, we can roughly guess what's going on, as we see a long span bridge on the upper arch. We also see a reverse smile line, and a lower premolar to premolar dentition with occlusal wear, cervical abrasions, gaps, and very dark intrinsic stains. Moving on to the intraoral photos, we can already tell the cause of the patient's chief complaint. We see a lot of food debris and plaque accumulation along the abutment teeth of the long span porcelain fused to metal bridge. Clinically, the bridge was mobile due to the fracture of the bridge abutments on the teeth 1-3 and 2-4, and the single tooth 1-4 was also mobile. Here's more intraoral photos showing patient's left and right bites and also the patient's occlusal view. Here's the panoramic X-ray image. Again, we see a long span porcelain fused to metal bridge with the abutments on teeth 1-3, 2-3, and 2-4. The abutment fracture is apparent on tooth 2-4 in the 2D view. Cone beam CT was taken as well, and here we see tooth number 1-4 with root caries, tooth number 1-3 with secondary decay under the palatal margins, tooth 2-3 is root canal treated but with a periapical lesion, and tooth 2-4 is fractured. Here's the treatment plan for the patient. For the upper, we plan for a Straumann Proarch fixed solution. This includes extractions of the upper bridge and teeth, immediate implants with Straumann BLX, and immediate loading with a PMMA temporary prosthesis. For the lower jaw, the plan was to maintain the remaining teeth with scalings and root planings, crown restorations, and individual implants in the posterior region. The upper Proarch surgery was carried out freehand. However, even for freehand cases, I like to import patients' CBCT into co-diagnostics. This allows me to visualize the patient's anatomy, which helps me plan where to place my implants. Co-diagnostics also has implant libraries and prosthetic libraries. This allows me to decide not only the implant sizes, but also the prosthetic abutments that I would need on the day of surgery. This short video shows the planned positions of the implants and the subsequent angle corrections using Straumann screw-retained abutments, also known as SRAs. Straumann SRAs come in straight, 17-degree, and 30-degree corrections. And of course, for each, they come in different gingival heights. In this case, I use 17-degree SRAs for the front 2 implants and 30 degrees for the back 2. This allows me to have a straight path of draw and the screw channels coming out occlusally. This is how they look like during surgery. During the surgery, I find the Straumann Proarch guide tool very useful. With the clear angulation markings, I was able to perform my osteotomies according to my planned angulations. The fact that it is bendable and it has a ball joint connected to the midline pin allowed me to conform it to the patient's arch easily. The Straumann Velodrill kit that comes in the small form factor also made the osteotomy sequence simple and streamlined. These are the implant positions visualized in the panoramic reconstruction of the 3D planning. This is the panoramic reconstruction of the post-op CBCT, and this is the panoramic image of the patient 3 months after surgery. On the next day of surgery, we issue the immediate load PMMA provisional prosthesis. This is how it looks like on the patient. Here's the cross-sectional slices of the 4 upper implants and their respective sizes. 3 months later, we start the restoration phase for this patient. This is the occlusal view of the healed soft tissues. Here, we have the clear view of the Straumann SRAs intraorally. For the impressions, I did both digital and analog methods. The digital impression was pretty straightforward. Using Straumann's peak scan bodies, I connected them to the SRAs and I took a scan using Trios 3 intraoral scanner. Just to be sure, I also made a verification jig on the patient's primary model, separated it, reconnected it intraorally with some patent resin. I then did a pickup open tray impression. A master model was then poured. As much as I wanted the digital method to work with the simple scan bodies, the verification jig showed that there were some discrepancies, so we proceeded the fabrication with the master model poured from the splintered analog impression. For this patient, I made 2 different prosthetics. The first one was a monolithic zirconia bridge. I really loved the aesthetics for this set, especially how realistic the prosthetic looked, with just stains over the monolithic zirconia. Both the pink gum stains and the teeth characterization looked really good. The second set was a thimble bar bridge. It is a milled titanium framework with individually cemented zirconia crowns layered with pink composite material for the gums. Here you can see the shadows of the titanium framework with some trans illumination. This is how both of them look like intraorally, and from this view, you could already guess which one the patient went with. The patient ultimately went with the thimble bar bridge as it was thinner, lighter, and felt more anatomic. Here are the post-op intraoral photos. You can see the thimble bar on the upper Proarch restoration. I finished off the bottom with scaling, root planing, crown restorations, and individual Straumann group implants on the molars. Just to recap our long journey with this patient, this is his initial pre-op x-ray, this is the x-ray after surgery, and this is the final x-ray upon completion of his full mouth rehabilitation. I really learned a lot from this case, and there is still much to improve both surgically and prosthetically. But all in all, this patient was really happy that he could eat well and smile again, and because this patient is happy, I'm happy as well. This concludes my presentation, and I would like to take this opportunity to thank the patient, my wonderful dental assistants, the lab techs, and Straumann which made this case a success. Thank you very much.